Representatives of 14 different faiths met at the state capitol today to endorse health care reform in America.
The Oklahoma Conference of Churches also called for people of faith to be more constructive and civil as the reform debate continues. OETA's Lori Rasmussen has our story.
The Oklahoma Conference of Churches represents 16 different Christian faiths. Today, 14 clergy members from those faiths called healthcare reform a moral obligation.
What we can do to help is to demand that we have a healthcare system that is accountable, that is affordable, that is accessible and inclusive of all persons.
Reverend Bruce Prescott represents the Mainstream Baptist Church. He argues the Bible says health care is a shared responsibility that is grounded in common humanity.
I'm also here to apologize for the heartlessness and indifference of many Baptists and other Christians who appear to identify more with the priest and the Levite rather than the Samaritan in the parable of the Good Samaritan.
Members of the Conference of Churches were joined in their call today by members of the Baha'i, Buddhist, Unitarian Universalist, and Muslim faiths.
The sacredness of life and the responsibility of taking care of all of humanity are central tenets to my faith, Islam. The Quran defines the sacredness of human life as to save one life is as if you have saved the lives of all of humanity.
Reverend Stan Basler chairs the advocacy committee for the Conference of Churches. He says healthcare reform is consistent with the mission of Jesus to help the poor.
It's that idea that the first requirement of a just society is to see that everybody's basic needs are met. That's not really the way we approach things as our nation state.
Basler says the Conference of Churches is not offering specific solutions for reform, rather working toward the goal of universal health care. He also says that means the federal government has a role to play.
Well, I think it is clear in the Old Testament that God is holding Israel, the nation, accountable for the welfare of its people. Now, whether that means in our case that legislation is formed to create a public option, or whether legislation is created without a public option, if the end product is such that everybody gets just and adequate, at least, health care, I think that's consistent with the theological goal.
The Conference of Churches also said in a position paper that personal choices and behavior do play a role in the poverty that has led to the health care reform debate. However, they add that economic practices and structures contribute to the systemic causes of poverty. At the state capitol, Lori Rasmussen, the Oklahoma News Report.